Welcome back, everyone. October is Breast Cancer Awareness Month, and we want to make sure that people out there are well informed about self-care, early detection, and prevention. That's why we brought in Dr. Teresa Baker from Texas Tech Physicians OB+GYN, joining us today with some important reminders. First of all, let's just talk about the guidance in terms of breast cancer screening.
So it's been kind of confusing over the last few years, but I think we've all settled on you should get your first mammogram at the age of 40. And then about every year until you're about 55, and then pretty frequent after 55, because we know there's a few things you can't change. One is if you're a female, you're at increased risk. One is your age. And when we know the statistics are 1 in 8 women get breast cancer
1 in
now.
8.
I mean, that's a big number. So we do need to screen. There's a lot of hesitancy to screen because it's not fun, it's not comfortable, but the treatment and the cure rates of breast cancer are so good now when we catch it early. I just encourage everybody to just do something nice for yourself, schedule a pedicure, and then just go get your mammogram.
Let's talk about the guidance and how they affect those higher risk factors like family history.
So if you have a family member with breast or ovarian cancer, or you know you're a genetic carrier, or you've had previous chest radiation, there's a lot of things that put you in a high risk category. When that's the case, you're going to have to start screening earlier. For instance, if it's in your family, we go 10 years below the youngest person that was diagnosed. But sometimes it's so young that a mammogram's not really utilitarian until you're about 40. So when we need to screen earlier, it might be with different modalities like MRI or ultrasound or something like that. That's another hard decision, is when you're going to test and should you test. And the truth of the matter is you're doing yourself a favor, because if we know, we can be proactive and we can do things that are going to help us diagnose early and help extend your life and help those other people in your family make decisions that make sense.
There's a lot of self-care proactive things that you can do. Let's talk about symptoms and signs that our audience can pay attention to, so that way they can know if they need to call their doctor. So
the biggest thing that you'll notice is a lump. That's the number one thing that people will feel. Mammograms should pick up breast cancer before you can even palpate it, myself or the person themselves. So that's why the mammogram is important. Other things that women need to pay attention to are any skin changes on their breast. So if they see something that is different, especially if it's causing the skin to retract, like dimple, if you see something new, like the architecture of your breast looks different, that should really get your attention. And then nipple discharge, anything that really that you think this is different than what has been previous in my life, then you should come
call the doctor immediately. Let's talk about kind of prevention and lifestyle then at this point. What can they do?
You know, the most important thing is weight management. If you can manage your weight throughout your life, your chance of getting breast cancer is significantly less. And then the other things are things that we teach everybody. Don't smoke, you know, very minimal alcohol intake. Be good about going to see the doctor, having someone examine your breasts, and being self-aware enough to go if something changes.
And final takeaway?
Don't skip your mammogram because you don't have money. There are so many programs. There are so many people that want to help. If what's holding you up from getting a mammogram is money, please don't let that be the case. Reach out to us. We'll help you. We'll help you find a program, put you in contact with somebody. Just get screened. It's your best chance of having a good outcome.
Dr. Baker, thank you so much for being here, and we're going to have more stories about breast cancer awareness over on our website, myhighplains.com, throughout this month, so check that out. All right, Dr. Baker, good to see you. We've got more Studio 4 after this.